Hello and good afternoon to one and all present here today at the ABP Education Admission Fair webinar on psychology and psychiatry, the career options. Today we have an esteemed panel here with us, comprising of two industry stalwarts, Dr. J.R. Ram and Dr. Prasanta Kumar Roy. I would like to begin with a quick introduction of both our panelists and then request Dr. J.R. Ram to take the discussion forward. Uh, our first panelist is Dr. Prasanta Kumar Roy, who is the head of the Department of Clinical Psychology at the Institute of Psychiatry, a center of excellence based out of Kolkata, and he's also a consultant clinical psychologist. He comes with over 15 years of experience in clinical teaching and practice and has published many scientific research papers. He is also one of the core professionals in the country into disaster mental health initiatives for the last 15 years. We welcome you, sir. Along with Dr. Roy, we have Dr. Ram. Dr. Ram is a psychiatrist at Apollo Hospital. He is also the Joint Director of Mental Health Foundation, Kolkata. He has accreditation as a specialist in child and adolescent psychiatry in the UK, and he's worked there for 11 years before moving back to Kolkata. Dr. Ram is also the co-founder of the Mental Health Foundation, which focuses on providing treatment for children, young people, and adults with mental health problems in a multidisciplinary setting. He also acts as an advisor to several social care organizations working with children and women. We welcome both of you on board, and we look forward to a quite an insightful discussion for students wanting to pursue psychology or psychiatry as a career option. Over to you, Dr. Ram. Thank you so much.
A very good afternoon, Shivangi. Very good afternoon to everyone who have tuned in. I would first at the outset like to thank ABP Education for organizing this because primarily, there is over the last few years, I would say about last 7 or 8 years, about a decade now, that there is an increasing interest in mental health, which has led to an increase in interest in career options which help people who are having mental health problems. So I think there cannot be a more timely webinar on this topic, because we all have become acutely aware of the mental health needs during this last 1.5 years, and many of us have fielded questions from young people regarding career options. So it's again a privilege to have Prashanto, a good friend, a very, very reliable work colleague whom we have worked together. And it's a privilege to have him. I think one of the advantages of having Prashanto with us is that he has got a huge, apart from having a huge clinical experience, he also is in the teaching profession. He trains clinical psychologists. He has a pan-India network of many organizations where he helps and where he advises. So it would be lovely to hear from him regarding the vast range of things a young person can pursue after doing psychology. So to begin to talk about what I do, I'm a psychiatrist. Now, there is a lot of confusion regarding who is a psychiatrist, who is a psychologist, who are therapists. So let me set some of the confusion clear. A psychiatrist is a medical professional. By that, we mean that in order to become a psychiatrist, you need to pursue science in this country and then appear for your MBBS education, which is about 4.5 years of training. And then you need to pursue post-graduation in psychiatry. Now, once you complete your post-graduation, which there are 3 forms of post-graduation available in India. First is a diploma, which is a 2-year degree. Then there is MD, which is a master's degree, which is a 3-year degree. And then there is something called DNB, which is the Diplomate of National Board. which again takes about 3 to 4 years to complete. So these are the three postgraduate routes which young people, after they have become a doctor doing their MBBS for 4.5 years and 1 year compulsory internship. So after 5.5 years of training as an MBBS student, you can pursue post graduation in psychiatry through these three domains. So one is MD in psychiatry, the other is DPM, the diploma in psychological medicine, and the other is DNB in psychiatry. Overall, there has been a great shortage of psychiatrists in India for a population of 1.2 billion. I think the figure is around 7 or 8,000 only, which is by, you don't need to be very imaginative to figure out that this is grossly inadequate. And we have about 700 postgraduate seats in India, which opens up every year, but the number is rapidly increasing. So, therefore, people who are wanting to pursue a career in psychiatry, the options are plenty. It's a fascinating field, and I'm not saying this because I am a psychiatrist. Many of you would know that mind is a fascinating, organ, or brain is a fascinating organ, and we are all perplexed by it. And the reward, both the scientific reward and the working in this domain, where you get to know a person, where you walk alongside a person, see them kind of go through the struggles and hopefully recover in many, many situations, is immensely rewarding. So I think this is what I would like to say as a preamble, and I would like to ask Prashanto to talk about a much wider domain really of psychology. Over to you, Prashanto.
Thank you, Dr. Ram, for your nice introduction. Maybe a bit more. And thank you, ABP, for considering this particular issue for this discussion. It is true, Dr. Ram, as you said, and that around 7 to 8,000 psychiatrists are there. And if you look at another part of mental health professional, that is clinical psychologists, it is less than 2,000 in India. Okay, so you can understand the inadequacy in terms of uh, the people who can provide mental health support for the people who are having mental illness. Just 2 days back, one boy, he is a doctor, did his MBBS, and he had some psychiatric problem, a depressive episode because of a significant. It started with significant life crisis, and now he is completely recovered with the treatment, pharmacological treatment as well as the psychological treatment. Recently, he has got a very good score in one of the medical entrance test, and now he wants to go for psychiatry, and he was asking whether he should go for psychiatry or not. So now people are also showing interest. When I had my training during MPhil in clinical psychology around 20 years back, during that time, the institute I studied, Central Institute of Psychiatry, Ranchi, uh, Pagol Khana bolte loke. People used to say it Pagol Khana,
Madhouse.
a madhouse. So there hardly the seats used to be vacant. Used to be vacant during that time, but now the mental health professionals, psychiatrists are now coming for this, and obviously clinical psychologists are also now more in number. Many institutes have started the training program in clinical psychology. So in this regard, but I would like to say like psychology and clinical psychology may not equate. The psychology is the main stream, uh, and that can have many branches. Unfortunately, students, the common people, are having many misconceptions about those branches, lack of awareness about those branches. And if you see, like, who is a psychologist? Person who has done a graduate course in psychology, a BSc in psychology or BA in psychology from an university, And after that, if that particular person has done MSc or MA in psychology, that is post graduation in psychology from a recognized university, or now the many distance modality have also started their courses, and those courses are also UGC recognized. So now the universities are having their courses for psychology. So till post graduation, whatever the specialization, the psychology courses are having their specialization: clinical, counseling, experimental, applied, crisis management, forensic. So these are the various specialization, industrial. But those specialization do not indicate that I'm having proper training on that particular field. Post graduation is simply a academic course. It is simply academic course with some special orientation, some extra learnings, some extra knowledge about a particular field of psychology, particular branch of psychology. With this understanding, I can make my decision where to go for next. Or if I want to go for teaching, the teaching is a good scope. With that particular specialization, I can become a teacher in the university or in the college or in the school. Now many schools have started their psychology courses since class 9, 10, 11, 12. So now the people, after becoming a psychologist, they are also approaching the school as a teacher. Okay. So this psychology primarily is having a scope in the teaching profession. Now if I would like to go for a treating profession, that is the mental health professional who are going to treat a person who is having a diagnosable mental illness or mental health conditions. For that, after post graduation, we need to go for additional 2 years full-time course. It is not online, it is not distance mode. It is a full-time course with complete supervised training from Rehabilitation Council of India recognized institute. This Rehabilitation Council of India is a body that regulate the training program, that regulate the standard of the training program. Everything, even the syllabus is being regulated by the Rehabilitation Council of India. And after completion of the MPhil in clinical psychology or MPhil in medical and social psychology or MPhil in rehabilitation psychology, these are the three areas, three MPhil qualification that we can see. Though the MPhil in medical and social psychology, MPhil in clinical psychology are the same course, uh, and rehabilitation psychology is slightly different. But for after doing this course, RCI provides a license to practice as an independent professionals to treat various mental health conditions. Without this RCI registration or RCI recognition, if I'm going for any kind of course, whatever the psychology course, and after doing that particular course, if I like to treat individual having mental illnesses or mental health disability without this RCI registration, then it is illegal in India. And this is also applicable for if I'm having foreign qualifications. Probably I have done some psychology training program, some postgraduate training program from USA or UK or Australia or some other parts of the world. Uh, the India RCI might not recognize those training courses. So they need to apply to the RCI to evaluate, to check whether those courses are acceptable in India. And based on that, RCI might provide some license to them. So this is one aspect of it. And there are other branches, and some of the branches are already established, like post graduation in industrial psychology. People can go for it is equal to MBA. It is equal to MBA when MBA is a new degree. Industrial psychology post graduation is an old degree.
Okay.
Before MBA was there, the most of the people had training under industrial psychology. They used to join the HR post. It was not that popular in the eastern part of the India, but in the western part of the India, it was quite popular. But after MBA came, they took over mostly. But again, because of the better training scope in industrial psychology, now many industries are showing their interest.
So Prashanto, just to kind of interrupt, once I complete my master's in psychology, what are the different options? So one is very clearly you have laid out where people can, if I want to go in the clinical line, by clinical line meaning where we are working with clients, working with people who are expressing distress. So that is one aspect where we are treating people who need help or advising people who need help. So that is one option. But what is fascinating, you are also saying that maybe after masters, I may not join that and do go into HR. So what are the other options which, you know, there are after masters? So one is teaching, you said, I can become a
Yes.
teacher in schools, colleges, and therefore qualify all the exams which the teachers need to qualify for. Human resource, industrial relationship is one uh, aspect. The other thing which I think at least some people I have seen that they what are the other options which people have for once they do a master's in psychology?
Uh, Training is another option. We can go for after doing the specialization in psychology. People can go for many manpower development training.
Corporate trainers.
Corporate trainers they can go for. So that is another personality development program, communication skill improvement program. So these are various training program they can go for.
The
And
other, yeah,
yes,
sorry.
and another aspect is various social organizations, non-governmental
Absolutely.
organizations. There now many social organizations are working for trafficking women or children, sexual abuse, rural development issues. In all those sectors, there is good scope of psychology.
Absolutely. So, a lot of the community organizations which work directly with marginalized sections of the society, maybe women, children, uh, children who have been abused, children who have been trafficked, women who have suffered domestic violence, acid survivors, the whole range. I think working with those organizations is a very, very rewarding area for many psychologists. The other thing which I have learned recently is many of the policy development, where international organization, donor organizations, Indian organizations, think tanks, they also um, recruit a lot of psychologists because of their foundation in research methodology. Because I think uh, many of the psychology programs in India, abroad, they have very good training in research methodology.
Yes,
So
yes,
data gathering, how do you implement programs? What are the barriers in implementation of programs? That is also a very, very rewarding area. And I think in future, this will become a major area of expertise.
yes. Experimental psychology is one branch that primarily focuses on the research application. So many people, after doing the experimental psychology specialization in post graduation, they are joining many of the research institutes.
Okay.
Right? Even now, the DRDO, Defense Research Organization, they are also recruiting their scientists who are actually psychologists, experimental psychologists, or other applied psychologists. So they are recruiting. And now there's another new branch that has emerged is forensic psychology. It was not that popular, but now it is hugely coming up here in India.
Can you tell us a
Up,
bit more about the subspecialty, the papers you said, experimental, forensic, can you explain that for all our viewers?
yeah, yeah. Like experimental psychology focuses mostly on how to go for human and animal behavior related experiment. so that we can understand the human or animal behavior in a proper way. Along with that, how to apply various research and statistical approaches uh, for overall analysis of various psychological construct. So that is the primary domain of experimental psychology. And it also focuses on how to develop various tools so that we can identify, we can measure some of the psychological factors. So that is one. Forensic psychology, as I said, it is a comparatively new one. And after establishment of National Forensic Science University in Gandhinagar, that was known as Gujarat Forensic Science University, they have also started a program on MPhil in forensic psychology after post-graduation in psychology. So these people primarily focuses on the criminal
Behavior.
justice system, criminal behavior, and many of famous cases, no, many murder cases that we have read in the news media, uh, and most of those cases had been referred to this kind of institutes for the psychological evaluation of the people, of the
One is
victim.
experimental, the other is forensic.
Forensic. Another new branch just this year has started is cyber psychology.
Oh,
Yeah,
okay.
this has started a postgraduate diploma program. It is not a degree program; it's a diploma program, cyber psychology. That basically the goal is to study the human technology interaction. So how technology is going to influence the people. But whenever I'm going for social, more of using social media, what are the psychological aspects are working, when there is a more possibility of becoming addicted to the technology, how the pornographic issues, the various criminal issues are being handled using the technology, and how to help people to come out of that, how to
Okay.
identify, how to detect who are more vulnerable using this
I think
interface.
it has got both sides, isn't it? Thinking more about it, Prashanto, that cyber psychology. So I can, if you are an expert in cyber psychology, I can come to you and say, Prashanto, I am addicted to my smartphone. I am addicted to
Yes, yes.
um, all these gadgets. So help me come out of it. Or Mark Zuckerberg might come to you and say that, Prashanto, help me in getting more people hooked on to Facebook. So I think Social Dilemma is a very famous, documentary which we all enjoyed on Netflix. So
Many hackers, they consult the cyber psychologist.
okay, right. So I think it's a very very look. I'm kind of it would must be a fascinating because I think you can help the. Also, there is I assume at least on paper many of these large companies, Google, Facebook, they say that they are practicing responsible industrial practices. So I think for them, uh, cyber psychologists would be uh, helpful so as to not get people addicted to it. Although it sounds a bit contrary, but that is a fascinating domain. So what about developmental? And so tell me, in masters, what are the various options I can choose in our country? So I'm
Uh,
a
yeah,
first year or second year student. What are my options in MA?
the clinical psychology is my option.
Okay.
Counseling psychology is my option. Developmental psychology,
Okay.
industrial or organizational psychology is my option. Forensic psychology is my option.
So
And
then depending on
educational psychology is my option.
right. So quite a varied choice really, and then you go into whichever branch for further specialization or further work. Because you mentioned this word counseling, uh, the number of times any mental health professional hears this question that Prashanto, Dr. Roy, do you do counseling? Dr. Ram, do you do counseling? Can you tell me a bit more about demystifying, you know, what is counseling, what is therapy, and why can't friends also talk? There is this whole thing, let's talk. So I post a Facebook thing that my house is open. If you want to have coffee and come and talk to me, my door is always open. So why would I not go to that person who is offering me free coffee and pay Dr. Prasanta Roy a steep fees and go for counseling or therapy? And what is the difference in between all this?
I will tell you a story.
Okay.
It's a story of my patient. And she was 32 years old lady who was suffering from 28 years old lady who was suffering from a severe depressive episode. And it started after her own brother committed suicide. And when she came to us, it was much delayed. It was already in a very difficult state, already 5 6 months. And once she came, we asked why, and she was quite psychologically aware, because her brother was also under treatment of psychiatrist. So she had been aware. So we asked what was the reason for this delay, and she informed us, okay, one of her the brother-in-law, Jijaji, who is an engineer, and he is fascinated about reading various psychological books. And most of the time, he tries to provide some kind of psychological advice to the family members. So somewhere he read that depression happens because of the oral dependency. If my oral need
I know.
is not fulfilled.
Our Guruji at one stage 200 years ago said that. So
Yeah. So if my oral need is not fulfilled, so I'll be depressed. So he suggested that that means we need to fulfill your oral need. So there is some lacuna there. And what is suggested, you buy a feeding bottle and you
my
devote 2 hours of time with this feeding bottle, your depression will be there. Well, I tried with the feeding bottle for 2 months and it didn't happen. Rather, my depression became more severe. So that actually happens when a lay person, the amateur psychologist who tries to do something to help. Jijaji's intention was quite good. But the problem is, without understanding of the proper theory in the cultural context, in the scientific context, and current evidences, there is a possibility of doing more harm than
absolutely.
helping someone.
Just before you go on to counseling and therapy, I think for everyone, all the viewers, the young people, I must clarify what Dr. Roy is trying to mention about the oral phase not being kind of successfully negotiated. Is it is a theory propounded by Freud, who is actually one of the largest scientific figures along with Darwin in our civilization. Uh, but again, improper application of a theory uh, can lead to such tragedies. And at least this person came for the right help and got cured. We all know that there is something called this whole concept of treatment gap in India. 85%. So if 100 people have mental health problems, only 15 of them would be able to access proper help. So therefore, it is very important for all of us to know the right modalities of treatment and where is it available. So I think that is a very important point. So Prashant, if you now go on to this
Yeah.
advice, counseling, therapy,
Yeah.
that
So the counseling is an overused term.
absolutely.
In almost every field, you will hear the term counseling and counseling, as if it is something to fit. It is not like that. In mental health, whenever we talk about counseling, that means the person is trying to help someone's emotional problem. If that particular emotional problem is not severe one, the person is having the strength or capacity, the counselor is going to generally strengthen or highlight that particular capacity so that the person, the sufferer, who himself or herself can deal with his or her problem. So that is, and counseling is having various schools of counseling. various strategies or techniques of counseling. Counseling can be if the parents are not able to manage a particular child. So the parenting counseling can be some strategy. Those skills can be taught to the parents so that they learn how to become a good parent. A good parent means scientifically applying the strategy of positive parenting. Okay. Or if I'm stuck to somewhere, I'm unable to solve particular problem.
Suppose in my job I am having a problem, I am not able to deal with my boss, and
Yeah.
then
Yeah. So in that case, counselor can teach me some of the techniques or strategy about how to negotiate so that my things can be done. Probably I'm unable to assert my issues. I'm unable to say no whenever I want to say no. That is creating lot of stress, lot of anxiety. The counselor might teach some of the assertiveness technique, some of the communication skill technique. By application of those techniques, I'm being able to manage my boss in a better way. As a result, my stress, my anxiety would be much less. Though this is not a mental illness, it is not a mental illness, but this is a problem where I'm getting stuck. So, counselor is not going to give me a particular advice that you do this, you don't do this. Counselor is going to help me to identify the source of the problem and going to teach me some of the skills. And once I start practicing those skills, I'll be able to solve some of the problem. If after practicing of those skills, I'm unable to solve some of the problems, then the counselor might look for some other skill, some other deficiency where the training might be provided. So it can take 4 sessions, 6 sessions, 8 sessions, depending upon the situation, depending upon the difficulty that I'm facing. Yes.
so I see there is something very important which you pointed out, which is it is different from giving advice.
Yes.
A friend, a father, a spouse, a colleague might give you advice, but a counselor is helping you to enhance your skills.
Yes.
So I think that is an important point. So that is the
Yes.
difference between giving advice and doing counseling. Yeah.
By giving advice, I'm making someone dependent. But using counseling, I'm making someone independent, not from for the problem that he's having now, but also for future issues.
Absolutely. Okay.
Okay. So, and now psychotherapy is more than counseling, where more intensive psychological support is needed for the individual or for the family member, where some mental illness is there. Mental illnesses might include, we talk about depression. Now people are having confusion about uh, the difference between sadness and depression. Sadness, the 100% of the people bound to be sad.
That at any point in time. Yeah.
Yeah. So, but whenever I'm becoming depressed, that means at least for 2 weeks I'm having some difficulty, and that is creating difficulty in my day-to-day activities, day-to-day functioning. So probably we don't have the scope to discuss about various mental illnesses here, but mental illnesses means these are interfering with my daily activities, my family life, my occupational life. And as you mentioned about treatment gap, uh, we also talk about year lost to disability due to mental illness. And whatever the non-communicable diseases are, like cancer is a non-communicable disease, cardiovascular disease is a non-communicable disease, diabetes is a non-communicable disease, COVID is a communicable disease. So whatever the non-communicable diseases are, mental illness is also non-communicable. According to World Health Organization, the year lost to disability is one of the highest in mental illnesses.
Absolutely. And I think it will become the topmost. So, what Dr. Roy is referring to, for the viewers who may not be very aware of the concept, see, there is a lot of data regarding how human productivity is impaired. So, suppose I have chickenpox, I will not be able to work. Uh, and therefore, I will not be contributing to the gross GDP of the country. So there is a lot of calculation, economic figures, which calculates that which are the illnesses which takes away the earnings of the people and earnings of nations. And what we have now figured out is that in next 10 years, mental illnesses will be the leading factors of disability which contributes to impoverishing a nation. So all of us, all the viewers can imagine the scale of the problem for which treatment specialists and people who understand the problems are needed.
Yes, that is true. So, as we are continuing about psychotherapy, but Dr. Ram, can you explain the viewers about the difference between the psychiatrist and clinical psychologist
True. I
before
think
you
again
go
there is,
for
because
psychotherapy?
everyone,
Yeah.
the number of people who are disappointed when they hear I am not a psychologist, it's astonishing. I think none of them are happy. No one is happy to hear that I am a psychiatrist. So, oh, you are not a psychologist. So I wish in my next life I will try and become a psychologist. Uh, See, basically, if we take from the perspective of the community, of the people who come to us, who comes to us? People who are having a range of mental health problems or a range of mental illnesses. Now, these problems or illnesses can be dealt with after proper assessment, and I must use this word very, very carefully. See, helping a person who is having problems has two parts. One is doing a proper assessment through scientific methods and then offering treatment. So, if someone comes to us, then what we do is we do an evaluation. And for evaluation, what I would do as a psychiatrist and what Prashanto would do as a psychologist is possibly 90% the same. And then I would do the treatment and Prashanto would do the treatment. And it is in this treatment part there are differences. So
But they are contributory
they are
to each
contributing.
other.
Absolutely. So, see, psychologists and psychiatrists are like brothers and sisters, maybe even non-identical twins. We are not identical. There are
Yes.
important differences. So, Prashantos, the psychologists, they are experts in applying diagnostic tools, doing what is known as psychometry, which is an in-depth analysis of the various factors of our personality, intelligence, which psychiatrists are not qualified to do, and they are not trained to do. So psychologists do the assessment in their specialized way and offer a range of therapy or counseling. Now, therapy, as Prashanto has indicated, can be various different kinds of therapy and various different kinds of counseling, which he will elaborate hopefully. And for a psychiatrist, our treatments are mainly pharmacological treatments, where we use drugs, medicines, along with some degree of support, counseling. See, counseling is inherent, giving advice is inherent to all uh, medical specialties and all branches. So we do bits of counseling, but our main modality of treatment is through medicines, which, whereas for psychologists, their modality of treatment is through talk therapy or counseling or psychotherapy. And very commonly we share clients, so there may be a person whom I am seeing and Prashanto is seeing, and most people with mental health problems do require more than one professional mm, helping that person. So I might kind of come to a psychiatrist first, get better with my uh, medicines, and then I might choose that I am now ready to look at my difficulties in life, maybe my problems in my job, problems in my family life, problems with my addiction, and then I will go to Prashanto seeking help. Can you do counseling or therapy to get rid of my addiction? So that is a very typical example.
Yes, thank you. And when I'm going for therapy, depending upon the person's problem, I need to decide that which form of psychotherapy would be more suitable for the client. As I was trying to tell, that psychotherapy is more intense. That means it can take 6 sessions to 10 sessions to 12 sessions to 20 sessions, depending upon uh, the uh, the length of the difficulty, the severity of the problem, and obviously the kind of support system that I am having. Whenever support system is good, number of sessions would be less. Now in psychotherapy, as Dr. Ram said, that various forms of psychotherapy can be there, but depending upon the problem. For example, if I am having sexual difficulty, right, that is creating problem in my marital relationship, so there are some particular psychotherapeutic technique, behavioral technique, some skills that is being taught, and by application of those skills, as my sexual difficulty can be worked upon. Another psychotherapy that we frequently talk about, that, see, when we suffer, suffering is manifested through our emotional expression, either the feeling sad or depressed, feeling anxious, feeling fearful, feeling guilty, or feeling ashamed. So these are various range of angry, range of emotions. So it is very difficult to directly target the emotional part. So we try to look that whether the emotion is only responsible or not. Many times what happens, the people, they start blaming that I'm weak, uh, that I cannot regulate my emotion. So we try to uh, make the people understand initially that it is not the sign of weakness, rather it is the sign that you are a human being and you are facing some crisis that is creating the problem. But now, for example, the COVID-19, during this COVID-19, five people are having similar crisis. Whether all the five people are going to manifest a similar emotional expression or not. So there might be differences, but what will trigger the differences? So we try to identify the kind of the meaning they provide to the trigger, the kind of interpretation or judgment they are having, kind of thought they are having about the situation. And if you teach some of the techniques to modify their thought process, their belief, their interpretation, that can bring desirable change in the emotion. So this is one particular school of psychotherapy, popularly known as, now many patients come with कि सर मेरा cognitive behavior therapy कर दीजिए,
CBT, everyone.
CBT.
So I think there are many varieties of psychotherapy, many forms of counseling. But I think what we all of us would like to insist is that we, all the young people who are going into the branch, need a proper accredited training program before they embark on their journey, so as to not to feel disappointed later. Because fortunately or unfortunately, India is a country which is governed by some archaic laws, and in order to practice peacefully, we have to abide by those laws. So what Dr. Roy very specifically mentioned about a very critical and emotive issue, I must say this is a very critical and emotive issue, is that whole idea of recognition in our country for people who are practicing therapy. Uh, there is a lot of misunderstanding about who can practice clinically, who cannot practice clinically, what is legal, what is not legal. And I think for all the young trainees, all the young people, they need to be cognizant of the fact. Now, I might choose not to be certified, not to be RCI registered, and everyone has got ample scope in, to choose to do that. But I think we need to be aware of the land of the law. But a more basic question, Prashanto, before we go on to the question, and I will answer that after you have. Why should anyone go into psychology? What are the benefits? Why, what as a clinician, briefly, if you tell me, if you go to an education fair where there are young students asking you, why should I choose psychology? What would you say? And the number two question is, don't you feel, a lot of people feel that psychology is a very burdensome kind of profession, and you get, either you will become mad or you will become burnt out. So what is your day like?
Yeah. The first thing is psychology is having tremendous growth here in India. As I said, many branches are now coming up. Forensic psychology now, many labs in India, forensic labs, they are hiring psychologists, forensic psychologists. Now it is becoming mandatory. And those forensic psychologists are also going into the teaching. Most of the labs now have are starting institute also, forensic institute. So these forensic psychologists are going into the teaching. Many forensic psychologists are working with CBI, this kind of organizations now. Okay, so it is prestigious profession. Now the military psychology training program has also come up in India. Many people are fascinated about serving the nation. And now as a psychologist, they can become a military psychologist and can join the military organization, can help them, the police and the military organizations, so that they can boost the emotion of the soldier. Sports psychology is another branch.
So there is enormous variety, branch, and it's a growth area. I think that is one thing which is very, the need is so high that in the foreseeable future, psychologists will be in huge demand. Tell me about what is a typical day like, a bad day at work. Tell me
Yeah,
about a bad day at work.
yeah. When I came here in Kolkata after doing my MPhil program from Ranchi, I started my private practicing, and my first month in 2005 August, uh, my first month income was 400 rupees.
But that was many years ago, though. So,
Yeah, that was 15 years ago,
okay.
16 years ago.
400 is a bad figure. Yeah.
Yeah, but as I was dedicated, yeah, I was doing my work properly. Within 2 years, the scene was different. So if I'm ready to put my effort, now if you look for engineering, for example, there are many engineers who are jobless. Recently, we're reading in the newspaper that in a Group D post, many PhD candidates have also appeared.
I think there is enormous reward in mental health, and also, as you said, I think financially it is a satisfying.
Subject, yes.
Personally, I would say that for young people who want to pursue a career in psychiatry, uh, my take is that it is an absolutely fascinating field where you get to know more about the most fascinating organ in our body, which is the brain. And the next 20, 30 years will be the new adventures, new mysteries opening up. And if you want to learn more about the brain, how the mind works, and if you want to know about a person, about a human being's mind and how it works, how it fails, how it triumphs, I think psychiatry is a field for you. Also, psychiatry is a branch of medicine which is rooted firmly in the community, in society. So psychiatry is not practiced in the clinics. Psychiatry or psychology, large part of psychology actually, and psychiatry draws its resources from cafes, from films, from books, from movies. It is out in the streets. So if you are a human being who is interested in society, if you are interested in literature, if you're interested in philosophy, if you're interested in sociology, and if you want to put brain on top of that, psychiatry is the branch for you. Regarding success, failure, I would like to quote someone whom from one of my favorite movies. In Three Idiots, Amir Khan's character said that uh, कामयाब बनने की कोशिश नहीं करो, काबिल बनने की कोशिश करो. And I firmly believe that. I think we should try and be good at what we do, and success will follow. So if I open a pan shop, let me try and be the best pan shop in my community, and then I would be successful. So I really don't think profession inspires success, that we can't decide that I want to be successful, therefore I choose this. Let us try and be good at what we do, and we will get ample rewards for that. So I think the other worry is that mental health can be draining. It indeed can be, because we do see a lot of human misery. We do experience patients killing themselves. We do face a lot of young people coming to us and talking about abuse. But again, life is that. Life, it is a privilege. And again, I choose my words very carefully, that some other person has entrusted you with this, that they have want to walk along with you in their recovery. And I think it is a great privilege, it is a great blessing that we are able to do that. And I think that is one of the biggest rewards, which makes my day worthwhile even after a bad day at work. So
Here
I
I would like to want to add one quote. We say that when you are part of the solution, you are no more part of the problem.
absolutely, absolutely. So and
But otherwise, we are being exposed to all those negative things through media. We don't have to do anything, any there. But here I am intervening somebody. I am providing some solution.
So we are part of the solution. It may be a long journey, maybe a hard battle, and we don't win all battles, but at least we try. So I think that is uh, because Olympics is going on. In an Olympian spirit, taking part, trying out, reaching out is more important.
And their
So
psychologists are also having good role in
absolutely,
their success. Sports
success.
psychologists.
Yeah, sports psychology. So can we bring in Shivangi now? Because I think there must be some questions. Oh my God, we are running out of time. So I think we spoke more than we should have. Apologies for that. Shivangi, questions from
Uh,
your side, from
Thank
the...
you so much, both of you, for such an insightful discussion so far. We have a lot of questions pouring in. Keeping the time constraint in mind, I'll just put forward a few of them to both of you. So I'd start with the first question, which is, what are some of the best colleges in India to study psychology, and what are some great career options? Career options you both have discussed. In terms of colleges, could you suggest the students what would be a good idea? Which colleges would in India as well as abroad? What could be suited for the students?
Now, many colleges, including private colleges, are coming up, and difficult to pinpoint which colleges are great about it. But however, some of the colleges, I will suggest to students to look for the NAC score. And now all the colleges are having their NAC scores, and some of the very old colleges are doing very good. Uh, like the Calcutta University, I will suggest Calcutta University is one of the best in psychology. Banaras Hindu University, these are the government university I am talking about. MS University of Baroda, where from I studied, that is also good. Mumbai University Psychology, Pune University Psychology, Delhi University particularly. So these are all great colleges. Now many private institutes, universities are also providing good psychology program. I would suggest like Christ University is having good thing. Amity University, they are also providing good courses. So there are various organizations now the informations are available, but focus on the NAC score and also focus on the number of faculty members, a number of specializations. These are very much important.
And I think how many research publication has come out of the department, how many
Yeah.
citable publications they have. Yeah, Shivangi, anything else? Any other questions? You are muted. Yeah.
I'm going to club two questions in one. So someone asked that what are the qualifications to become a full-fledged industrial or organizational psychologist? Another question that is related to it is as well, what is the average salary of an industrial psychologist? And is it a good career choice, and how to convince my parents about this profession? Please suggest.
Okay. Generally, post graduation in psychology with organizational or industrial psychology specialization, and after that there are some PG diploma course. There are some PG diploma course in organizational psychology and consumer behavior from some of the universities, including Tata Institute of Social Sciences. So, with these, there is a good scope of becoming an industrial psychologist, and the salary depending upon the organization, the salary also, but many as they are going to work in the HR field, it can be around 40, 50, 60. It depends on the situation,
On the
depends on the
start
experience.
salary, yeah.
Yeah, the starting salary I'm talking about.
Okay, Shivangi.
Dr. Ram, would you want to add something to this?
No, I think my knowledge of this, Prashanto is always obviously an expert. I think in my experience, if you go into the clinical field, MPhil psychology, a freshly turned out MPhil clinical psychology with a couple of years of experience, most decent places should pay around 40,000, 40 to 45,000, I think is starting salary. And there is no end to, depending on how much well established in your career, I think the upper limit is quite high. But I must say, there are far more lucrative professions than psychiatry and psychology. Majority of the people who come into mental health, uh, I must say, I'm not being boastful, have possibly greater vision of kind of helping other people. Uh, Otherwise, they wouldn't come into mental health. A lot of people have suffered personal experience. A lot of people have seen their personal relatives suffering from mental health problems, and they have this strong belief in helping others in the community, which brings them in. I think that has been my experience of why people come into either psychiatry or psychology.
Perfect. Thank you so much, sir. I'm going to address the last question again to the both of you. Psychiatry and psychology are the most important arena given the current context. Do you feel that in the field we need people from different professional backgrounds to ensure diverse and robust array of issues?
Absolutely. I think Prashanto will agree. See, what has happened definitely is that mental health, uh, in higher education in India hasn't been inclusive. There is, very little doubt about that. So, do we have people from the LGBTQ community who have high mental health needs? Do we have people representing their community? Do we have marginalized sections of the society? Do we have people from who have suffered great adversity? So, I think there is absolutely no doubt that we need as many people, the variety of people. So the community is diverse, and we need all kinds of people from every sections of the society to make it more representative. There cannot be two ways about it.
Yeah, I agree with this. It is much more needed as we are having around 12,000 total mental health professionals in India, and at least we need a lakh to fulfill some of the requirement.
And it has to be equally representative of, all genders, all sexual orientation, all economic sections, caste, creed, community, everything.
Okay, given we still have a minute, would you want to squeeze in one more question?
Yeah.
Okay, so there are two more. So the first one is, should everyone go for therapy, or there are particular signs where they realize they need a therapy?
No, I don't think everyone. I think this is a very, very important question. And, I would come back to the Jijaji, which Mama Prashanto referred. See, a lot of us are quite resilient. We look for resources within the community, self-help book, music, philosophy, literature, religion, spirituality. Many of us are able to overcome our difficulties by our own. So by no means everyone needs therapy. I think that is an important point. How do you decide whether you need therapy or not? Depends on whether you feel that you are able to manage, whether your close loved ones are able to tell you that, yes, we are not able to help you as much as you can, and go for therapy. And remember, Prashanto and all, we have discussed about this. There might be a single session therapy. You go and meet Prashanto once and that's it. You don't need to come back for therapy again and again.
Dr. Roy, would you like to add something?
Yeah, Dr. Ram has already mentioned about it. But however, if someone feels that, okay, there is some part of it, I need some improvement in terms of added resilience development, additional skill development, for that they can go to a counselor for some of the skill training. Otherwise, if I am having some warning signs like having difficulty with my sleep pattern, I am feeling concerned about myself, I'm getting suicidal thoughts, or I'm becoming very hostile or angry and I'm unable to control it. So if these issues are there, so that means obviously immediately I need to go for a consultation, a mental health professional's consultation without any hesitations. And that's it.
Okay. So the last question for the evening is, what are the benefits and risks of delivering mental health care through technology instead of face-to-face interactions, and what impact does the removal of face-to-face human interaction have? I guess this question deals with the pandemic and how everything is moved to the digital side. So, what would you think are the pros and cons of moving to the digital interactions rather than having a face-to-face session? So.
I think I will let Prashanto answer that first, and then I will.
Initially, I had my reservation about go for this digital interaction. But later on, with by dealing with my resistance, once I started seeing clients digitally, I found that the kind of difficulty I imagined, I didn't face that kind of difficulty. But however, many other issues are there. Confidentiality issues are there. Even their privacy can be a concern. We don't know whether the therapy session is being recorded and that is going to be used somewhere. So there are other difficulties are there. But however, as psychology is a human subject, and it involves forming a particular relationship, a trusting, comfortable, non-judgmental relationship. Uh, Once we see face to face, it might be easier to form that particular relationship than the digital one, particularly for some of the younger population or geriatric population who are not digitally uh, oriented. Uh, but I'll have my objection that uh, the psychotherapy, uh, we can go for a digital psychotherapy only. I will have my reservation about it. I'll prefer face-to-face therapy as my priority. Dr. Ram.
Yeah, thank you. I think you have highlighted some of the very important points. Couple of very brief bullet points, Shivangi. One is this form of therapy through digital media is going to stay, whether we like it or not, and I think it is going to improve uh, uh, even more through technology in maybe 5 or 10 years down the road. So we have to get adapted to it. Number one. Number two, there are great advantages it does not fulfill all situations. It is not a replacement of face-to-face therapy, but in many situations, lack of accessibility, where someone is not able to reach out to a therapist, it is helpful. The technological and the ethical challenges which Prashanto has mentioned, there are guidelines about that. I think the advantages are many, but the disadvantages are, ultimately that you really can't replace that kind of space. Therapy is also a lot about the space we are communicating. So that space also contributes to therapy. It is the room, it is the ambience, it is the bookshelf. Everything recreates those things, which in a physical space is more meaningful. The other important point is that in kind of face-to-face therapy, there are many, subtle nuances which do not get lost, which in a digital forum gets lost. I often joke with my patients, and I have seen that, when I joke online through this digital platform, it gets lost. The concern about digital therapy is that, are you talking to a chat bot? When I WhatsApp my problem, there are artificial, chatbots responding to it. So I think we will overcome those problems, but I think it is here to stay.
Thank you so much, Dr. Roy and Dr. Ram. Thank you for answering all the questions, and thank you for sharing all that insight with all the students who were really looking forward to this session. I hope this session has helped them a lot in deciding what they would want to pursue. I hope both of you have a really good evening, and thank you so much for being a part of ABP Education Admission Fair.
Thank you. Thank you, Shivangi. Thank you, Prashanto. It was a pleasure.
Thank you. Thank you.
Bye-bye.